Tell me the truth, this is the end. I feel like lose myself. Bring me to the top and find you in the end. Don't ever cry for me. Ooh, so tired of the truth.
Hey, Jenab! Hi, Rokia! Hey, Jenab, I heard your son is already married.
Yes, it is.
How many years have it been?
5 years, I think.
So, why don't I see any grandchildren around your house?
They didn't have yet.
Huh? Jenab?
Yes, Rokia.
It's been 5 years.
Yes.
Is your daughter-in-law infertile?
Hey, watch out, your mouth. I will shove this into your mouth.
Okay, I'm just asking.
Hey, you. Mind your business, okay? Shazana, come here for a second.
Alright, Mom.
I want to talk to you. Yesterday I met with Rokia, our neighbor. You know her, right?
I know Auntie Rokia.
Yeah, you know that she's kinda busybody.
Yeah, she's kinda.
And then she asked me, when do you want to have a children?
It's not our blessing yet, Mom.
No, it's not that I want to pressure, but you have to harder find an alternative. Just like the baby doesn't just come out of sudden, right? You have to work harder with your husband. Okay? I don't want to pressure you, but please, okay?
Okay, why do you see me? Do you have any problem?
So we have been married for 5 years and we are trying to conceive since then, but until now we haven't been blessed yet.
Oh, so you didn't get baby?
Yes.
Okay. Are you financially stable?
So I would say moderately because both of us work together to meet the ends meet.
Okay. I have an alternative for you, which is IUI, infertility treatment. So do you know what is that?
We are not very sure about that.
Okay. Don't worry, my doctor will explain to you.
Infertility is a health issue worldwide with an estimated prevalence of 10 to 15%. One of 7 couples experience an unfulfilled desire to have a children that lasts for more than a year. So, what can we do for them? A lot of treatments are available nowadays, whether they are traditional or modern. IUI is one of them. Penn-Doctors pioneered intrauterine insemination. A large study in New England Journal of Medicine verified it as a safe and effective tool to treat infertility. So today, IUI continues to be a valuable tool to treat infertility and increase the chances of successful pregnancy. The overall success rates of IUI are varied. The mean pregnancy rate per IUI cycle is 9 in the most, but it depends on various factors such as total motile sperm count. Researchers found couples with a post-wash total motile sperm count of at least 9 million had a pregnancy rate for one IUI cycle of 16.9%. However, for patients with sperm counts lower than 9 million, success rate steadily fell. So, for whom your doctor recommends IUI, it's for people that have been trying to conceive baby for at least more than a year without knowing the root cause of infertility. Second, for people who want to use donor sperm to get pregnant. Third, for people who have a semen allergy and also ovulation problems.
What is the factors of infertility problems in men and women?
I will talk about factors of infertility problems in men. The first one is infection. Some infection can interfere with sperm production or sperm health, or can cause scarring that blocks the passage of sperm. These include inflammation of epididymis and testicles, or some sexually transmitted infection, including gonorrhea and HIV. Although some infections can result in permanent testicular damage. Most often, sperm can still be retrieved. The second one is hormone imbalance. Infertility can result from a disorder of the testicle themselves or an abnormality affecting other hormonal system, including hypothalamus, thyroid, pituitary, and adrenal glands. Low testosterone and other hormonal problems have a number of possible underlying causes. The third one is chromosome defect. Inherited disorders such as Klinefelter syndrome, which is a man that born with 2 X chromosome and 1 Y chromosome instead of just 1 Y chromosome and 1 X chromosome. This can cause an abnormal development of the male reproductive organs. The fourth one is radiation or X-ray. Exposure to radiation can reduce the sperm production, though it will be often eventually return to normal, but with high doses of radiation, the sperm production can be permanently reduced. Now we jump into the factors of infertility problems in women. The first one is polycystic ovary syndrome. Polycystic ovary syndrome is one of the most common causes of women's infertility. It is a condition in which a woman's ovaries and some cases and adrenal glands produce more androgen. With the high levels of this hormone, it interferes with the development of ovary follicles and release of eggs during ovulation. The second one is uterine fibroids. Uterine fibroids is a non-cancerous growth that form inside the uterus. Uterine fibroids can cause some symptoms in some cases depending on their size and location. Scientists do not know what causes fibroids to form, but it is believed that it's related to genetic basis. Fibroids can contribute to infertility and are found in 5% to 10% of infertile women. Fibroids are more likely to affect women's infertility if they change the position of the cervix, which can reduce the number of sperm that enter the uterus. The third one is infection. Chronic infection in the cervix and surgical treatment of the cervical lesions associated with the human papillomavirus infection can also reduce the amount and the quality of the cervical mucus. Problem with the slippery and sticky substance that collects on the vagina and in the cervix can make it difficult for women to get pregnant. The fourth one is endometriosis. Endometriosis is a common cause of infertility. This thing can happen if the endometrial tissue implants around the ovaries or fallopian tubes. Many women with endometriosis have a pelvic or abdominal pain, particularly with their menstrual bleeding. Some women doesn't have any symptoms. Endometriosis can make it difficult to get pregnant. Sometimes, endometriosis can grow inside your ovary and it will form a cyst.
For a person who struggles to achieve pregnancy, IUI may be the only treatment needed. IUI is a relatively non-invasive and less expensive fertility treatment compared to more invasive and costly treatments such as in vitro fertilization IVF. So the steps of IUI. First is ovarian stimulation using fertility drugs, either oral or injectable medication such as clomiphene citrate or gonadotropin to stimulate more than one egg during single cycle of ovulation. Second is cycle monitoring. Blood test or transvaginal ultrasound is used to track development of follicle in ovaries. Egg will be matured after 12 to 14 days. The egg will be detached from follicle and matured egg is released. Matured egg must be fertilized with sperm 24 hours after ovulation. Third process is sperm sample collected. Sperm will be centrifuged, washed, and also concentrated about 1 to 2 hours. This process is to find quality sperm and also to separate sperm from any seminal fluid to find any debris and also hormone that cause uterus to cramp. Last process is insemination ovaries. Sperm will be injected directly into woman's uterus through a thin flexible catheter. This process is very quick, just wait on a bed for 10 minutes and you are done. This process is painless as it doesn't need to use any anesthesia and the side effects are minimal. 2 weeks after, check if the pregnancy has been achieved or not.
Let's move on to the ways to increase fertility.
For men, exercise regularly, consider supplements, adequate sleep, and avoid excessive heat.
Moderate physical activity can boost testosterone level and improve sperm quality. However, avoid excessive exercise as they may give the opposite effect. Certain supplements may improve fertility, such as L-carnitine that can enhance the quality of sperm. Sleep deprivation may wreck your overall sperm quality. Nevertheless, getting too much sleep can also decrease the overall sperm health. Hence, getting 7 to 8 hours of uninterrupted quality sleep is the most important factor in increasing sperm quality. Prolonged exposure to high temperatures such as hot tubs, sauna, and even tight clothing can negatively impact sperm production.
And for the women, manage stress, limit caffeine, monitor ovulation, and consider supplements.
High stress levels can disrupt hormonal balance and ovulation. Hence, to combat this, techniques such as mindfulness, meditation, and yoga can help to reduce stress. Women who drink large amounts of caffeine may take longer to become pregnant and have a higher risk of miscarriage. Hence, even though you're a coffee lover, please remember to take everything in moderate. Tracking your menstrual cycle may help you to understand your own ovulation patterns. Tools such as basal body temperature charts and even ovulation tracking apps may help you in this. Supplements such as coenzyme Q10, which is an antioxidant that can help to improve the egg quality.
It is human nature to want kids. So, what is the Islamic viewpoint regarding infertility treatment? One of the prayers by believers as described in Quran Surah Al-Furqan verse 74.
والذين يقولون ربنا هب لنا من أزواجنا وذرياتنا قرة أعين وجعلنا للمتقين إماما.
Which means, O Lord, grant us with spouses and offspring which will be the joy of our hearts and will make us models for the righteous. This shows that asking and finding an alternative in seeking a cure for infertility is thus appropriate in Islam. What more? To strengthen my point, I will share you a hadith. The Prophet, peace be upon him, says, "Marry the kind and fertile woman who will give birth to many children, for I shall take pride in many numbers of my ummah." Islam gives strong and unequivocal emphasis on high fertility. So, those who are unfortunately infertile are allowed and actually encouraged to seek a cure for it. In conclusion, there are many options in seeking a cure for infertility, and today we have explained thoroughly regarding IUI, which is a safe option and, in our opinion, the best option for many. So, you don't need to worry because doctors all around the world is always ready to give you a solution for your health problems. And for that, I hope our explanatory video today will help a lot.
I think we have a hook.
Yes, of course.
So doctor, when can we start?
Oh, we can start with your appointment first.